Hello, Colin Hung here, and I am super excited about this next topic that we're going to be talking about, and that is nudging. As a marketer, this is something that I love talking about because we are trying to motivate people to take action, and we're going to talk about how to apply that to healthcare. Joining me on the program today is Chandra Osborn, who is the Chief Behavior Officer at Adhere Health. Welcome to the program.
Thanks for having me. It's a pleasure to be here.
So right off the bat, let's just get right deep into it. What is nudging? Can you define that for me?
Yeah, nudging is a term that is born out of a field called behavioral economics. And really how that came to be is because making decisions as a human being is very complex. And we know that there are a lot of things that go into decision making. One of the main factors is some biases that we have cognitively. And so what nudging does is it addresses and responds to those different cognitive biases that you have and that I have.
So obviously we in healthcare want to encourage good patient behavior. It's one of the main goals. So if we in healthcare master the art of nudging, what would be some of the outcomes and benefits? What would we see different?
Well, nudging is a particular tool in behavioral science that is ideal for very simple behaviors. For instance, getting a patient to schedule an appointment, getting them to pick up their refill. As the behavior gets more complex, we have to use different ingredients from behavioral science. So using nudging is great for some of those very simple things we're trying to get patients to do. And we want to preserve their autonomy. So we want to not use it deceptively. We want to use it in a way where there's transparency, because really it's in the best interest of the patient. And oftentimes patients want to do what's in their best interest. There's just a lot that's in the way.
Right. So can you give me an example of how you might nudge a patient to schedule an appointment that's really needed?
Yeah, sure. One example is to leverage a nudge called social proof. Social proof is this idea that people like me are doing this too. This was utilized quite a bit when we were trying to get people to get their COVID vaccine. And so there was a lot of marketing out there to show people like me are also getting their vaccine. And so that is social proof. Another nudge that is often used is a credible source. So having someone who is your CEO getting a COVID vaccine can sometimes influence whether or not other people are more inclined to do it or not. And so these are just a few examples, but there's actually over 100 possibilities in the ingredients that we can use to get human beings to do more health-enhancing activities.
Chandra, is there a right way and a wrong way to nudge patients?
Well, yes. And oftentimes the word nudge implies, without behavioral science in the background, a cue to action, a prompt. And yes, nudging technically does do that, but you really want to have expertise behind whatever approach you're using. So partnering with a behavioral scientist, leveraging their expertise is hugely valuable and important and really in the patient's best interest.
So a lot of, maybe I'll use nudging in air quotes, a lot of nudging today, especially around getting a patient to take an action like book an appointment, come to an appointment with this preparation, is done through texts and messages. Mm-hmm. It borders on nagware if it's done too often. What would a behavior scientist say to seeing that kind of constant reminder for the patient to take an action?
Yeah, you don't want to create friction. So we want to consider all the reasons why a patient may not be doing what it is that's in their best interest. And when we communicate to them, we want to make sure that the communication is infused with the nudge or the behavioral science technique that is designed to overcome whatever's in their way. So it could be remembering, and in that case, a text message reminder would be great. But that's not often the challenge that everybody has. And so being mindful of personalization, of timing, of the appropriate channel that a patient might want, of the different types of barriers that are in their way is key to communicating in the most individualized and meaningful way.
Right. An example that's frequently brought up is that some patients aren't forgetful that they need to make an appointment. They just can't find the time, or they don't want to admit that they have to take 6 buses to get to that place and are afraid to ask, is there a closer location? So sometimes being able to offer that, and to your point, personalize the message, say, hey, we've kind of booked the appointment at this time, this date, at this location, but if that's not convenient, click this button, go here, maybe give us a call, maybe we can make some other arrangements for you.
Yes.
Just to help that, because maybe that's the reason and it has nothing to do with them forgetting.
Or you might need transportation assistance.
Exactly.
And provide an outlet to be able to access that.
So what does can behavior science help us with those more complex patient behaviors that you mentioned before, when you get into things like smoking cessation and dietary and lifestyle changes? Does the science offer us any help there?
So it does. There are many fields of behavioral science. And when we think about more complex behavioral changes, sometimes you need to draw from those other disciplines that are not behavioral economics and nudging. So there are more beefy ingredients that can be applied to address the bigger barriers that are in the way. So a bigger barrier to losing weight, to stopping smoking, I mean, those are not only a single barrier, but multiple barriers. And they differ in size. And so you have to use a menu of different options to address those specific challenges that are in the way and do it on a very personalized level. We use what's called behavior change techniques. And those are designed to really help people that are trying to make initial and sustained long-term behavior changes.
Gotcha.
Yeah.
Gotcha. So let's bring it to Adhere Health. Thank you by the way, for educating me on behavior science and nudging. But let's talk about Adhere Health for a minute. How are you incorporating some of what we've talked about? And then what are some of the other things that you're doing at the company?
Absolutely happy to share. So at Adhere Health, we're infusing behavioral science in how we communicate with health plan members. Health plans are our main customer. And we're really communicating with their Medicare Advantage populations, largely around medication adherence. 1 in 4 Medicare beneficiaries doesn't take their medications as they should. And medication adherence is heavily weighted in a health plan's performance at the end of the year. And so we come in and we use an omni-channel approach to outreach to each individual in a very personalized way to identify what's in the way of them picking up their medication and taking their medication, and using behavioral science to address those specific barriers and challenges the member has.
And what are some of the results that you're able to show to these plans when they adopt your solution?
Well, for one, we're able to, what we call in behavioral science, Little E engage them. Little E is where they pick up the phone, they respond to the text message, they're engaging with us. Big E is medication adherence. And we're able to show significant improvement in medication adherence. These plans are interested in getting 5-star ratings at the end of the year. And we have a really good track record of increasing star ratings for different health plans.
Amazing. And I'm sure the patients are benefiting as well, because these are medications that they should be taking and should be on in order to manage their conditions, right?
Absolutely. And we assess how well we do. We actually ask the different members if they would recommend us, like an NPS score, to their friends and family. And we actually score very high. So, yeah.
And in terms of other areas, are there any other areas that you're going to get into other than medication adherence? So medication adherence is the main behavior problem we focus on, but we also address Part C of the star rating. So trying to get patients with diabetes to go ahead and get their A1C test, to get their eye exam. So if we're on the phone with them already, talking about adhering to your insulin, we're also going to help you schedule that appointment with your provider to do your recommended diabetes checkups. So if I was a plan leader and you were trying to convince me to maybe take on Adhere Health, what would you say to me to convince me that you're the one to go with?
Well, one of the main differentiators that we have at Adhere Health is that we have a behavioral scientist on staff. Medication adherence has been a behavioral science problem for almost 3 decades. And it started with getting HIV positive patients to take their antiretroviral medications. That's how long I've been studying this problem space in my career. And so bringing that expertise, that evidence-based approach to driving changes in behavior is really a unique capability that Adhere Health brings. And I've been with the company for only 6 months, so I'm really excited about all the great things ahead of us.
Where can people go to learn more about Adhere Health?
Yeah, you can find us on our website, adherehealth.com, and you can get more information about us and reach out to us there and on social.
Amazing. Well, Chandra, thank you so much for being on the program today, and thank you for all the education.
It was great to be here. I really appreciate it.
This has been Colin Hung for Healthcare IT Today. Thanks for being here, and I'll catch you on the next video.